Good afternoon, everyone. Thank you for joining us this afternoon. My name is Alison Bull. I am the manager for our newly formed primary care practice development team with Hunter New England Central Coast Primary Health Network, and I am joined by Christina Robinson from Cubiko, head of customer success. I'm the project lead for the PHN Sustainability and Viability Initiative as well. To start, I would like to acknowledge the traditional custodians of the lands we walk, reside and work upon, and pay respects to First Nations people and value the continued connection to culture, country and waterways and contributions to the vast region. So thank you again for joining us this afternoon for this Cubiko presentation. This is brought to you to complement the recently released grant for a 12-month subscription for a Cubiko license. The EOI is open now and represents one of the sustainability support activities of our Sustainability and Viability Initiative, which you may affectionately know as SAVI. So as you might know, this initiative aims to improve the viability of general practice businesses across our region, with a particular focus on supporting general practice businesses that are grappling with viability issues across workforce operations and/or finance, so that they can access the resources and support and tools that they need to improve their viability. So more than half of the practices across our patch opted in to participate in SAVI, and results included that many general practice businesses do not have resources or capacity to invest in sustainability support platform and/or are otherwise constrained to adopt a proactive approach to business viability, that practices need support to access digital health enablers, including health intelligence platforms. Positively, that almost 75% of practices are ready for digital change, but only 55% of practices reported to be engaging in meaningful use of digital health solutions. In the results, there is a call for better integration and support for the use of digital health technology, and the report or the results also identified barriers to the adoption and implementation of digital health technologies, including costs and also the increasing complex nature of digital health, which requires upskilling of the current workforce. And that's the opportunity for all of us. So part of the PHN's response to those findings is to address this gap, to increase access and usage of impactful health intelligence platforms, and to help practice owners and/or managers better manage their business. And so the PHN are proud to be partnering with Cubiko and working closely with industry experts like Christina to launch the PHN's interactive sustainability support platform powered by Cubiko. So this partnership aims to provide practices with the tools to use their practice data proactively and to improve the health of patients and also the practice finances. And with that, I'm delighted to introduce today's presenter, Christina Robinson, Head of Customer Success at Cubiko. Christina has over 10 years' experience in the healthcare industry, has been foundational in operating super clinics across New South Wales before stepping into the role of practice manager and business manager in clinics across New South Wales and Queensland. Christina is well versed in practice accreditation and compliance and is passionate about helping practices across Australia to become data empowered. Thank you, Christina.
Thank you, Alison. I'm excited to be part of this project and to be presenting to you all today. So I'm going to give you a little bit of an overview of Cubiko and how you can achieve financial sustainability in your practice using Cubiko. So I'm going to go through some information slides, and then we're going to jump into a bit of a live dashboard to have a look at what it looks like as a customer of Cubiko. So let's look first at the importance of data in your practice. So data can be used to track performance, identify areas for improvement, increase your patient satisfaction, help reduce costs, improve patient outcomes, and then also increase staff efficiency. So Cubiko helps you get the most out of your data in a number of ways. We provide quick reporting, so it helps generate reports on your key performance areas, which will save you time and effort and help you stay on top of your progress and performance. We provide customizable dashboards. So creating custom dashboards that displays the data that's most important to you and your team. The data visualization really helps make it easier to understand. So this can help identify trends and patterns that you may not have noticed otherwise from an Excel spreadsheet. It's also a collaboration tool. So Cubiko is a collaboration tool that allows you to share the data with your team, and this helps you make better decisions together. So Cubiko can then help review the workflows for your practice teams. So doing this regularly helps improve efficiency in your practice. So general practice is an ever-evolving landscape, and Cubiko is as well. So we're always adding new and exciting features to help your practice. So Cubiko is designed to be shared with your practice teams, and we've created recommended workflows to help you get started creating and customizing your own workflows for your practice teams. So Cubiko can be used not only by your management team, but also by your reception, nursing team, and also your doctors. So to get started, we're going to look at some key metrics to review. And these really focus on billings and cash flow. So maintaining practice financial stability is key to running a successful practice. So let's take a look at the top key data metrics for a successful practice. I've got down here total billings, your bulk billing percentage, outstanding debt, did not attend rate, and your chronic disease management billings. So let's take a look at these in a little bit more detail. So why is it important to track your total gross billings? So this is crucial for several reasons. And firstly, it provides a clear picture of the financial health of the practice by showing the total billings generated before any deductions or expenses. So this information is essential for assessing practice profitability, identifying billing trends, and making informed financial decisions. You can easily compare your billings to the same time the previous year, as well as being able to set a practice target within your Cubiko settings. So key areas in our total billings metric to look at, you can break it down by practitioner, and this really allows for individual doctor analysis. And then you can also see your trend of billings over time and also break it down by item number and appointment type. So if you're running a mixed billing or private billing practice, understanding your bulk billing rate is crucial to determine your current billing preferences and how you can work towards a better business strategy for your practice. While your overall bulk billing percentage is helpful in determining how your overall practice billings are being split between private and bulk billing, breaking this down by key eligibility groups will help you identify areas where your practice bulk billing policy may have room for improvement. For example, your practice may have implemented a mixed billing policy and now charges a discount private fee for your concession card holders. But upon reviewing your data, you find that the percentage for bulk billing patients in that group hasn't changed significantly. So you can then review why this may be the case. If your bulk billing has decreased, this in turn can lead to a higher amount of outstanding debt in the practice due to having more private patient accounts. So you want to review your outstanding debtors on a regular basis. You want to know what is your current outstanding debt amount, what payer category has the highest debt value, and how can you reduce your debtors. So you can identify if your current unpaid account process is working to recover your debt. Having a good debt recovery process will help increase your cash flow. So cash is key to the continued operation of the practice and ensures you can review your debt regularly, and you need to create lists for your team to follow up. So keeping your debtors low not only helps with the cash flow, but it will also help demonstrate to the practitioners in your practice that you're working on minimizing what is owed by patients and other account holders. So looking at ways to streamline your debt process in the practice, this is an example of a daily reception workflow. So you can check the outstanding accounts metric in Cubiko. You can provide a list to your reception team of what patients are coming in for that day who have an outstanding account, which gives your team the opportunity to flag this with the patient on arrival so they can finalise those accounts. Our next key data metric to track and measure is your did not attend or no-show rate. So reducing your DNA rate is vital for practices as it will ultimately help improve your patients' access to your healthcare services. The potential value of impacted billings from your did not attend patients can also be quite significant, and this will impact both your cash flow and the profitability of the practice. So from our example practice here, looking at the past year, we can see they had a did not attend rate of 4.96%. So based on the average billing per appointment of around $58.93, and this is a metric calculation provided in Cubiko, looking at the average billings of each appointment, this has added up to be potential lost billings of $111,000, which is quite a substantial amount. So we get asked all the time at Cubiko, what is a good DNA rate? And it's a great question. So now we can refer to our Cubiko Touchstone dataset to look at the last 365 days and see that the average DNA rate for practices is around 2.45%. This is going to lead to the question, what is Touchstone? So we can use our Cubiko dataset, which we call Touchstone, to review industry trends. Our Touchstone dataset has over 800 medical practices opted in and is one of the largest benchmarking datasets for Australian primary care. So Touchstone is a feature within the Cubiko product that allows practice to opt in their data to a de-identified, aggregated data set. There is no patient data captured in our Touchstone data set. So looking now at our key data metric around CDM billings. There's a number of reasons why general practice should focus on chronic disease management and having an effective CDM program established in their practice. General practitioners are often the first point of contact for a patient with a chronic condition and play a vital role in managing chronic diseases from early diagnosis to ongoing care. It's estimated that almost half of all Australians have a chronic disease. So chronic disease management items can help GPs to provide more comprehensive and coordinated care to their patients with a chronic condition, and this can lead to better patient health outcomes. So chronic disease management items are a valuable source of revenue for general practice as well. And by increasing billing for these items, practices can improve their financial sustainability. So reviewing your chronic disease management billings in your practice will help track growth, uptake, and success of your CDM clinics. So nurses provide valuable support to your doctors by completing and documenting parts of the CDM process, saving the doctor countless hours each week while also increasing billings in the practice. By increasing nursing support for CDM clinics in your practice, the practice goal is to also see an increase in the number of services being completed and the billing revenue from these item numbers. So reviewing your CDM billings and number of services completed will help you track improvement over time. You can review how your CDM billings have changed and how they compare to the same time the previous year. We also have a calculation for CDM billings as a percentage of your total gross billings. It's a great indicator of how much CDM billing you're completing in your practice. You can also track how many CDM services are being billed, and you may want to review this kind of metric on a weekly or monthly basis and download the data to be able to track and report on it over time. You can then use the data collected to help set goals for your practice, ensuring that the goals are measurable and achievable for your team. So item 10997 is designed to assist patients who require access to ongoing care and monitoring and support between the more structured care plan reviews. A maximum of 5 services is available in a calendar year for each patient who is currently on a care plan. So in Cubiko, you can review your 10997 completion rate for the current calendar year to see how your practice is tracking with increasing optimization of this item number. You can calculate this completion rate from the number of item 10997s billed divided by the total eligible item 10997s for your patients. So use the completion rate data to provide visibility to your nursing team so they can track how they're progressing throughout the year and celebrate their achievements. Keeping track and comparing this figure to your previous calendar year completion rate is great for knowing if the steps you've taken to increase billing and optimizing 10997s in your practice has been successful. So looking at our Cubiko Touchstone data set for last month, we can see the CDM percentage of gross billings is sitting at an average across all practices in our data set at 9.76%. So you can use this data to then work out if your practice is currently above or below the average and use it as a guide to what goals you may want to set for your practice team. Running a thriving and successful CDM program is not easy, and to help ensure the success of your CDM program, it is important that you have a dedicated team of doctors, nurses, and support staff who are passionate about providing proactive care to patients with chronic conditions. So there are 4 key parts to our suggested CDM workflow. So firstly is setting goals on what you'd like your CDM program to achieve. So while you may have big plans for your CDM program, it's important to set small, achievable targets to start for your team. This can be as simple as growing your CDM program by a set number of patients each month, or simply getting all your patients with out-of-date care plans back up to date. Setting goals and tracking progress doesn't have to be complicated, and the essence is about understanding where you are now so you can see how you have improved in the future. Next is optimizing CDM eligibility. So using your practice data to find opportunities and potentially eligible patients to increase bookings for chronic disease management in your practice. Then you want to review utilization and capacity. So it's really important that you look at your team's capacity and appointment availability before reaching out to patients and booking them in. So while your team may be really keen to see and treat your CDM patients, they may not have capacity to do so. And the last thing we want to do is ask a patient to book an appointment, but not have any availability for them to do so. And lastly is getting your team involved. So that is one of the most important parts, is bringing your whole team along for the journey. And the success of your CDM program is reliant on your whole team's participation. So it's important that you're encouraging your team and provide them with training, support, and tools to help them succeed. And in turn, your patients and CDM program will reap the rewards. So now looking at that, we've got item optimization in Cubiko, and this looks at a range of Medicare service items that your patients may be potentially eligible for. So these include chronic disease management, health assessments, medication management reviews, nurse services, mental health treatment plans, as well as your DVA CBC program patients. So there are 2 ways you can recall patients for item eligibility for these services: opportunistic or proactive patient engagement. So in Cubiko, you can use our possible service opportunities today metric for your opportunistic patient engagement. This will help you see which patients are attending on the day and what they're potentially eligible for. This is a really great metric for your whole practice team. Your management, your nurses, your reception team, and your doctors can also get involved with their version of possible service ops today. So opportunistic patient engagement is really focused on finding those patients who are eligible for a service item number, such as CDM or health assessments, while they're attending the practice for an appointment already. And using that opportunity to either perform the service on the day, if possible, or getting the patient to book for that service at a future date. So an example of an efficient workflow for opportunistic patient engagement is creating a list of potentially eligible patients who have an upcoming appointment for the current day, checking their eligibility for the service with Medicare, provide a list of those patients to each practitioner so they're aware of what service items their patients are eligible for that day. And then the practitioner can either incorporate performing that service or advise the patient to book in for that service with reception on the way out from their consultation. You can do this in a couple of ways. You can have a doctor direction sheet that the doctor gives to the patient to provide to the reception team on the way out, and that outlines what service to book for. Or they can also enter the instructions directly in your practice management software by using a notes to reception feature when sending out the billing, which will let reception know what to book the patient in for. Proactive patient engagement is focused on finding those patients who are eligible for your service item numbers and recalling those patients to book for the service at your practice. You can use our item optimization cabinet for your proactive patient engagement. So these metrics provide you with a full list of practice patients who are potentially eligible for the different services. An example workflow for proactive patient engagement starts with creating a list of the potentially eligible patients, focusing on your RACGP active patients, so those that have had at least 3 appointments in the last 2 years, checking that eligibility with Medicare, and then reviewing that list with your doctors for their approval to recall and book. You can contact those patients using a method that suits your practice and your patient demographic, and you can try a few different ways to see which ones work best. Examples are using traditional methods such as phone or sending a letter, but you can also send bulk SMS messages through third-party software systems as well. So looking now at our billing optimization cabinet in Cubiko, we have 2 key metrics in here to use, which are uncompleted patient appointments and unbilled appointments. So uncompleted patient appointments may indicate that there's a missed billing opportunity. So you can use this metric as part of your daily or weekly checks to maximize billings generated from the work your doctors are undertaking. So from a review perspective, you could also use this metric for your admin team to set a goal of having 0 uncompleted appointments each day. Or you could have them communicate any uncompleted appointments to you, as it can be practitioner related, as why it couldn't be marked as completed or marked as DNA in your appointment book. Unbilled appointments, this metric is a great way to find any potential missed billings. The reason for could range from team members accidentally not billing or the doctor not putting a billing through at the end of the consultation. It'll help identify, and you can tailor any further staff training that may be needed for your team. So maximizing cash flow from existing accounts is essential for the financial viability of the practice. And without this knowledge, it may otherwise represent lost billings. So a regular review of your historical opportunities is a great way to also pick up on potential misbillings and increase revenue for the practice. So some key ones we look at each week are billings on hold, which aims to review any invoices over 90 days old in your practice. So looking at that, you can then find which invoices need to be actioned and finalized to make sure that your practice has a consistent and healthy cash flow. Then we also have your historical opportunities. We have historical 10997 and also 10987 opportunities. So looking at your nurse services. And this can assist in finding appointments that were booked with your nurse team where one of these nurse services could have been performed but was not billed. So a few different ways you can use these metrics is setting up appointment types for these specifically in your appointment book, so that when you use our Cubiko metrics, you can then go in to track those specific appointment types and see if it's a potential misbilling. And the other way to look at it is you're able to see where a patient was eligible for that service but did not actually have it performed on the day. So it's also looking at where there was opportunity for that service to be provided, and then you can work with your nursing team to see if there's times or different appointment types where they are in the treatment room seeing your nursing team, that you can actually use that time to perform a 10997 or a 10987 on your patients. We also have historical flu vaccine opportunities. So this is a great one during flu season, or certainly at the end of your flu season, for making sure that you were billed for every flu vaccine encounter that you had. So you can find a list of patients who received a flu vaccine as recorded in their immunisation history, but have no corresponding invoice for that date. So you can provide this list to your nursing team to review. They can then complete that patient file audit and discuss with the relevant doctor to then bill appropriately. Okay, we're now going to dive into our example Cubiko dashboard of what you would have as a customer, and we'll go through some other metrics as well. Just get ready to share our screen. Okay, so this is an example of a Cubiko dashboard. And in here, we also have our specifically designed dashboard if you're coming on through the PHN Expression EOI program. So we'll have this dashboard available for you during training, and we have basically put together a range of metrics from within Cubiko you can then use as a starting point as part of your use. So we've put together this custom dashboard. All customers are able to create as many custom dashboards as you like. We have a feature on the side here called dashboards and favorite pages, and you can come in and you can create different areas of Cubiko, grabbing the metrics and creating a focus dashboard. So you can create one for different team members. You can create one for your reception team, your nursing team, and then you can also change it up. So some practices might like to have a different focus each month, or perhaps each quarter, and then they use that to then share with their teams and get them to focus on specific metrics in Cubiko. So looking at our homepage here, this is the sort of range of metrics that you have available. We have our menu options along the middle here, as well as each of these cabinets, which then contains a range of metrics within these. So as you can see, each of these metrics then deep dives a little bit further into a more detailed list where you can then action and provide patient lists to your team and do that as well. So having a look here, this is our possible service opportunities today that we just spoke about, looking at our opportunistic patient engagement. So this one is where a lot of your admin and nursing team will be accessing, and they can come in to then see the summary table for the upcoming day. Can see the appointment date here, a list of patients coming in for that current day and what they're potentially eligible for here. You can use our quick check integration feature to then check their eligibility directly with Medicare through Cubiko. So if I go back out using the breadcrumb here to today's clinic metrics, that's our possible service opportunities today. And then our quick check feature link is here. So quick check allows you to check chronic disease management and mental health treatment plan items directly with Medicare. So this will allow you to select up to 10 patients at a time and be able to run that eligibility check directly through Medicare. The results, as we saw, come back in and also populate over to our service opportunities today table. So we can see here that items that are crossed out means they're not eligible with Medicare, and items that are bold have been verified eligible with Medicare. The other items, which are just in normal text, are items that we can't check through the quick check feature. So they'll be things like your nurse services, vaccine metrics, and health assessments. You can also open this in a new window. So just popping this open, so your nurse and reception team can have this open throughout the day and have their practice management software underneath. And this will give them a list of patients and what they're potentially eligible for. It's a little bit nicer to look at. It's got the color coding, which is really handy. You can search for specific patients. You can use the filters to filter it down as well. And that'll give you a list of patients coming in and what they're potentially eligible for. If you have used the quick check feature, you will then also get the other categories. So you'll get verified eligible, which means Medicare said yes, and verified not eligible, which means Medicare said no. And then the other items we don't check through quick check remain in the may be eligible to book for. So it's always a suggestion. A lot of our eligibility for item numbers is based on billing history at the practice, as well as demographics. So that's a little pop-out sidebar, which your team can use as well. And then just having a look in today's clinic metrics, we have some other really handy metrics that you can use in here regarding your recall process. So looking at that from your unactioned inbox items through to your recalls and then your recall appointments. And then I know a big one, investigations contacted, not given. We also have a great metric around shared health summary uploads. So if you're looking to ensure that you're meeting your EPIP requirement for the uploads, you can come over here to our date range and look at a PIP quarter and then make sure that your uploads are in line with that requirement as well. So going back to the homepage, some other great features that we have in Cubiko to help your team is things like vaccination support. So vaccination support, we have 3 options in here for our BP integration customers. And we have in here your COVID-19. So we did bring this out back when the pandemic started. So if you're still administering COVID vaccines, we do update this to be the latest ATAGI advice. You can also look at data historically on how many vaccines you have administered over time. So you can actually look at how many doses were administered at the practice. So that's reading the patient's immunization history. You can look at the patient eligibility based on the latest guidelines. And you can then click through to get the patient list to recall. And then you can also look at upcoming appointments for COVID vaccinations at your practice. I guess our most used vaccination support cabinet is our flu vaccine cabinet, which is fabulous to get started with. Using this in February each year, getting ready for the flu season. Cubiko measures the flu season from the 1st of March to the end of February. So it resets on the 1st of March each year. So currently this will be what occurred in your current flu season. It lets you know if you have patients coming in today who are eligible for a flu vaccine. So you can see here patient eligibility, total vaccinations for this flu season, how many you vaccinated last flu season, and then we do break down the eligibility into both your national immunisation program or government vaccines and private vaccines. So private flu vaccine, everyone is eligible for a private flu vaccine if they would like to pay for it. But we do refine it down to those in the practice who had a flu vaccine the previous year. So it means these patients aren't falling into one of these categories for the government subsidized vaccine. But here on this side, they also had a flu vaccine last year. So these patients are more likely to come to your practice and pay for a private flu vaccine. So helping with stock control, knowing what your demand may be for future flu seasons, it just gives you a lot of good information around stock control. Vaccination coverage, we break that down into your government and private flu vaccine coverage. So seeing what proportion of each eligibility group have been vaccinated. And we also show your patient count of flu vaccinations on each flu season. So you can have a look at the trend over time. We'll have detailed patient lists under each of these accordion headings, so you can do your bulk SMS recall. If you get your vaccines in, you can then send a text message to all your patients asking them to come in for their flu vaccinations. You can also use our other areas here looking at your upcoming appointments. So looking at how many flu vaccine appointment types you have. My demo data has none. Hopefully you will have some. And then you can have a look at your daily list. The great feature around this is that you can set up different appointment types in your practice management software, and then that will come through to Cubiko and you can actually measure. So you might set up one for your government funded flu vaccines, your private flu vaccines, or you might go even further and have one for your over 65s or one for your children. So one for each type of vaccine that you need to provide. And that makes it nice and easy at a glance to see how many you need to have in the fridge to be able to service that flu clinic for the current day. You can then also look at doses given by flu season if you really want to break it down into your different vaccine names. So we will have that information in here for you as well. So yeah, flu one is a really great one to do at the beginning of each flu season, and get your nursing team into using this metric. The other one we've added is for your shingles vaccine. So we are looking here at that eligibility for Shingrix. So how many patients are eligible for the 2 doses? How many have had their first dose and require a second? I know this is one of the more popular metrics that practices like to use because of the limitation in supply. So if they have a limited number of vaccines coming in that delivery, they may want to prioritize those that require their second dose over providing a first dose. And then you have your completed 2-dose course on the other side. So again, you've got your patient lists as well to be able to use that data. So that's our vaccination support cabinet. Another way to improve patient healthcare and outcomes is using our quality improvement cabinet. So we have designed this to really help get practices with their quality improvement activities, and also improving patient healthcare and getting patients booked in for different services. So anything can be a quality improvement activity, but we have designed these to really help step you through. So we are adding to this cabinet all the time. So we will be adding new quality improvement activities coming up, some very hotly requested features, which I won't mention just yet, but they will be coming out soon. But we do have some, so looking at the 10 quality improvement measures as specified by the Department of Health and Aged Care. So I am in the process of adding those into here, as well as some other ones that have different impacts. So you can do the quality improvement activity on your did not attend rate. So we looked at that before, and this is where you'll find that potential lost billings from your number of DNAs using the calculation of your average billings per consultation. So this becomes a quality improvement activity once you've identified it, and then you can use our little instructions at the bottom to start your plan, do, study, act cycle. We have a Cubiko template version. If you would like to view that, you can download that from our app here. And then you can use this to perform the quality improvement activity on did not attend rate. We also have one for allergies, so making sure that patients have allergies. We know that's an accreditation requirement to have 90%. So if you come in here and your RACGP active patient percentage is less than 90%, this is a great option to use as a quality improvement activity in Cubiko. And we generally will provide you with a patient list to action. So this is looking at patients coming in for the next few days who don't have their allergies recorded. So making it nice and easy. You can then print that list off. You can filter it by who they have an appointment with, so each doctor, and then remind the doctors to update that allergy recording on the patient file. Some other key ones that we look at is these ones. So diabetic patients recording having a flu vaccine, also COPD patients having a flu vaccine, and your diabetic patients having a blood pressure result, as well as ethnicity recorded. So the ethnicity recording, that's a great one for your reception team to be involved in. This is one that they can action on patient arrival at the front desk. So we can have a look and set goals in here, and then you can get your list of patients who don't have their ethnicity recorded, download that list for your reception team each day, and then they can update that on when patients are arriving at the practice. And you'll be able to see your trend over time and how that's improving. So some really great features to help get you started, especially if you're a beginner in the quality improvement world and you're wanting to know how to get started with doing that in your practice. These are really great ones to help step everybody through the process. So as we looked at in my slides, item optimization is going to be where you're going to find your service eligibility for all the different item numbers that Cubiko looks at. And each of these will give you that information and patient list to then recall. So we provide a lot of reporting. So there is a lot to look at in Cubiko, and I am going to just say when you get started with using Cubiko, you should just focus on a handful of metrics to get started. Each month, adding a new metric that your team can use, not making it an overwhelming process because there is a lot of data in Cubiko. But I think each practice, you should decide what your focus area will be, and then our customer success team will work with you in your session to then focus on the metrics that will help you get started and achieving that goal with your first focus. Once you've done that, you can then expand out to another area. So I'm showing a lot of areas today because it's a huge range that you can work with and they all link together, but certainly starting off with one or two things would be the better option. So if you were starting with Cubiko and you're looking at item optimization, you definitely don't want to be starting to recall all of these patients. You might be like, this month we're going to do CDM reviews. Next month, we're going to do our over 75 health assessments, and then stepping that through slowly with your team to help ensure that they're not overwhelmed and it's actually helping them do their job is the best process to get started. Just provides a lot of options to start with. So looking at our reporting, we looked at a lot of the financial reporting, and that lives in our past clinic metrics where you're going to see a lot of your financials and also your operational metrics around your did not attend rate, the number of new patients attending, the number of appointments that you have as well. But we also have information around your cohort analysis. So one of the key features that I really like in here is our patient list, and it's probably not the prettiest of metrics in Cubiko, but it's very functional. So our patient list is your entire active database. We can see we have the active filter on here. If I wanted to look at inactive and deceased as well, I can toggle that off. I can further refine it to be my RACGP active patients, so patients with 3 or more appointments in 2 years. And then I can use the filters here to find patients falling into certain categories. So we have things like your age bracket, gender. We also have if they have a concession card or healthcare card, if they're a DVA card holder. And then we also have whether or not their allergies are known, their ethnicity, and we've added 2 new ones recently. So we have smoking status and also alcohol status. So there'll be some sneaky new metrics coming around that as well, but the filters are in here already. So you can filter down to get a list of patients that you can then download. So all the data is downloadable in Cubiko. We have a download arrow on the right hand side, and you can use that to download any of our tables as a CSV file, which will allow you to open it up in Excel. And that will also allow you to then to do the bulk SMS messaging. If you're wanting to recall patients for certain things, the CSV file is the one that you can upload to some third-party SMS providers to then send out the bulk SMS. So looking here, we can then sort the columns in Cubiko by ascending and descending. So I can actually sort this by age, and then I can download this and I could focus on a specific age group as well. So some places that practices might use this as a bit of an example is we do have over 75 health assessments, but maybe in preparation for those patients turning 75, you might want to find your 74-year-olds and then send them a little bit of information around the health assessment that you'll be inviting them to come in for that and just preparing them to start on that over 75 health assessment cycle. So because it is a yearly health assessment, it is really good to start inviting patients when they turn 75 and explaining why they're going to be having this health assessment. So it is a really good one. The age brackets are wide, but once you sort the table and download it, you'll be able to find your patients that are exactly 74 at the time. So that's just one way you can use the patient list, but there are many ways to use that data in your practice. Another feature Cubiko has, My Medicare is very hot topic, and you do need to start, organising to register your patients with My Medicare with all the changes coming. So here we have a whole cabinet dedicated to My Medicare. And Cubiko also has the option to upload a CSV file of your My Medicare registered patients, which you get from Proda, into Cubiko, and then we can write back that data into best practice as well. Otherwise, if you're an MD user or you're using BP, they have their own upload feature as well now, and we will read that data from your practice management software. So once they're ticked as being My Medicare registered in your practice management software, Cubiko will be able to read that and we'll be able to populate our metrics with those that are My Medicare registered. So this will be really valuable. You actually saw when I went to the service opportunities today and popped up the side window, it actually lets you know there as well for the patients coming in for the current day if they're My Medicare registered. So it's really handy for providing services and knowing who out of your patient cohort is actually registered with My Medicare. So we have broken it down into the different groupings. So looking at patients who are registered or not registered for, say, your chronic disease management patients, that's based on their billing history at your practice. And we can then filter down to look at a list of your chronic disease management patients who are not registered that you may want to ask to register at your practice. We've also got your aged care patients here, and then also those that have ever had a telehealth or telephone consultation, and then anyone with a mental health treatment plan billing as well. Okay, so we did talk about that Cubiko is for your whole practice team. So lastly, I'm going to show you that it is designed also for your doctors to have access. They do not see this entire cabinet. This is the management level of access, and Cubiko can be customized from here for your nursing, your reception, and your doctors. So access for your nurses and reception team will be limited in the metrics that they see, and that is part of setting them up as a viewer for your Cubiko dashboard. We have a recommended set of metrics that we suggest to start with for your reception and nursing team, and that will be suggested to you when you're setting up the viewer in the settings area. Our workflows for reception and nursing team also align with that recommended level of permission. Then for your doctors, we have designed the My Cubiko cabinet. So essentially, this is a separate permission cabinet level. So when you set up your doctors, who are employee doctors or contractor doctors, not practice principals or owners of the practice, we are then looking at providing them access to only their data. So they're looking at their patient lists, their financial data, no one else's data. So once this is set up and they log into Cubiko, they will come into this My Cubiko screen, and they'll be able to see the possible service opportunities for the current day for the patients that they're seeing. So this will be all of their patient list for the current day, and they will also have the same window that they can pop up and have open the whole day next to their practice management software appointment book to be able to review the patients who are coming in and what they're potentially eligible for. So it's always really powerful tool to have the doctors, to have the knowledge to be able to encourage patients to book for services on the way out from their consultation. So this provides them the tool to have open and be able to find the patients. They can see if they're My Medicare registered, and they can see based on their billing history at the practice or through the Quick Check verified eligibility feature, what they're eligible for. So it's a really great tool and popular window for doctors to have open during the day. If they are interested in financial metrics, they also have access to the similar metrics that we have elsewhere in Cubiko, but again, it's refined down to be only looking at their own data. So they can have a look at their billing reports, their financials, so services and payments, and they can also look at their patients. So they can look at things like their recall process, how many recalls they have in play in the recall process, how many of them are urgent. They can also look at their My Medicare cohort. So we can look at the patients that are My Medicare registered to them and how many of them are CDM patients or aged care patients. And they can also look at their appointment book data. So looking at number of appointments, how many did not attend they have, and also wait time of patients. So they have quite a range of reporting and metrics that they can look at in Cubiko. And it's very similar to what you will see in your full dashboard, but it's just refined down to be only looking at their data. So once you're familiar with your Cubiko dashboard, you can then start providing access to your nursing and your reception team, and then also your doctors to really help with improving that rebooking of service opportunities in your practice. Okay, there is a lot I can show, but I might just stop there and see if we have any questions from anyone. If you do have a question, feel free to pop it in the chat and we'll do our best to answer that.
Thank you very much, Christina. And I will let the participants know as well that their cameras and mics have been activated by Sydney, who's sitting in the back end with the education team. So we invite you as well to jump on in and ask any questions that you might have. We are aware that while most practices are familiar with Cubiko, there are a number of practices who aren't familiar with Cubiko at all. So might have some questions they would like answered. But while you're thinking of those, I might just make a couple of comments on some information that stood out to me. And Christina, thank you so much for your wonderful presentation and all the information that you have provided. It's great to see that Cubico is designed for the whole service, for the whole practice team to be in service of each other, supporting to get the best outcomes for all of the patients seeing the practice. And I think that that's really wonderful and incredibly valuable and motivating for everyone. And just to reiterate that because of the number of metrics there, that it is great for practices to pick a particular focus, and the primary care practice development team will be working with all of participating practices to help them identify their goals and navigate through viability issues. So that opportunity is there for everyone. And the last point or comment that I would like to make is just that great to see that connection between quality improvement and income generation. One of the results of the viability assessment did show us that most practices are reliant on practice incentive payments and WIPs as well as part of their core income. So to tie in a quality improvement activity like the did not attend, that will increase income generation as well. It enables practices to work efficiently and fulfill the PIP requirements, but also improve the profitability. So that was great to see as well. I have a couple of questions that have come in. And we've got one that has come in from Laura regarding when will this be available. Well, good news, Laura, the EOI is open now and the platform is available now for you to access. So if I step through from the PHN's perspective what that process is, and I will then hand over to Christina to talk about the Cubico part of things. So thanks, Laura, for the question. So to complete the EOI, and the links are available on the PHN website. So if you pop in Cubico, you will get a good news story about our partnership with Cubico, but also a link to register to submit your EOI. A member of our team is reviewing those EOIs as they come in, and within a week or so, you will receive an email from a member of our practice development team that has a unique subscription key for your practice specifically, and also a link to register with Cubico. So there's a second link, a second step if you like. Thanks, Laura. And then once that's received, a member of Cubico will reach out. I will hand over to Christina to fill in any gaps. And yeah, thanks, Laura, for popping in.
Yeah, once we've received that expression of interest and the form filled out, we will ensure we've got all the details needed. Most importantly is your ID, so either your BP ID or your MD ID details. But if we need any more information, our technical onboarding team will reach out to you by email if we're not able to create a connection with your practice server. So once we have created a connection with your practice server, it takes a couple of days to do a full extraction of data to populate the metrics. And then once it's available to go, you'll be provided a login. We'll set up your login for the practice just for yourself as the person who filled in the form. Any additional access to the dashboard will need to be created by you. And then you will get access to our Cubiko Learning Hub, which has our online self-guided training courses, which are a great way just to learn the basics like navigation and filters. And you can pinpoint a couple of different videos that may be of interest, like item optimization or quality improvement. And then our customer success team will be in touch, and you'll have a one-on-one training session for the management team to help decide what your goals are going to be with using Cubiko, so that we can help focus you on the metrics around those to get started. Very exciting.
Thanks, Laura. Another question here. Oh, sorry, Laura, did you have any other questions while we're with you? Nope. Thank you very much. Reach out if you do after the session. We have another question in specifically around any chance to have some sessions to upskill nurses and reception on Cubiko. I'll touch on that just quickly, is that we are planning with Christina to have a series of drop-in education sessions on Cubiko. We're also upskilling the primary care practice development team on Cubiko as well, but certainly that will be available we do want the whole practice team to benefit from and have a good understanding of the use of Cubiko. And I'll hand over to Christina to provide a little bit more detail.
Yeah, we will. We'll definitely organise those. But in general, we also have a lot of online resources that we've created from our years of experience in helping customers get started. So, our Cubiko Learning Hub. Once you have a login to Cubiko, you can access those resources, and we have an online course. It's not too onerous. It's like half an hour in length and broken down into 5-minute videos for nurses and reception, covering the main metrics they would use in their role using Cubiko. Some key ways that we know practices have used in the past is also at your staff meetings. So you might have a nurse meeting or reception meeting. Is you can pick one of the videos that relates to a metric you're wanting them to use, play that 5-minute video in your meeting, and then talk about it and how you're going to use it in your practice. So that can be really effective way in making sure they have time to learn how to use Cubiko, which will then in turn benefit the practice.
Wonderful. Thanks, Christina. I'm going to throw to some questions that came through on email, but again, people are welcome to turn their cameras on and turn their mic on. Excuse me for a moment. So we do have a couple of questions about the difference between a self-funded or a general subscription and the Hunter New England Central Coast PHN, the grant provided platform. So essentially there is no difference in the metrics that will be available. What we are tailoring at the moment is the dashboard. So those base concepts primarily around ensuring that the metrics that are visible and most used by practices that we're funding the grant for are directly in line with optimising viability and are user-friendly for practices. So our aim at the PHN is that we maximise uptake of this opportunity by practices, support practices to use the platform frequently, and that in the weeks and months to come that there is impact in each practice, that their viability and their profitability has improved. One of the other questions is around ambient scribe integration, which I'm assuming is around artificial intelligence. I'm not sure where that might tie in with Cubiko at all, but in regard to SAVI, I am happy to advise that we are looking into all ways that efficiency can be improved for the clinical staff, including supporting with artificial intelligence. Happy to take questions out of session as well on that. Well, if there's no further questions at the moment, I would like to thank Christina again for your presentation and thank everybody for your participation today. As we said, the EOI is open now. It is exclusive for practices that participated in the viability assessment and have participated in SAVI. If you're a practice that hasn't participated in SAVI yet, then please reach out and we can discuss next steps. We'd love to have you on board, and we really look forward to sharing some good news stories about how Cubiko and our other viability support activities that we are rolling out to complement this. And I'll just let you know that that has included our partnership with AAPM. We are looking at some business coaching and working with some health industry financial advisors as well. So all in all, we are offering a suite of services for participating practices at the moment, and we're delighted to be working with Cubiko. Welcome any questions out of session, and thank you very much for joining us. There
Thank you.
also will be an evaluation that will pop up on the screen at the close of this session. So thank you, everyone.